What should a baby be doing in terms of social and play skills very early on? Today, we're talking all about that. Hi, I'm Dr. Mary Barbera, autism mom, behavior analyst, and best-selling author. Each week, I provide you with some of my ideas about turning autism around and signs of autism around. So if you haven't subscribed to my YouTube channel, you can do that now. So this week, we are doing a short excerpt from podcast number 187, which is a rebroadcast of podcast we did a few years ago on social and play skills. We are covering today just the excerpt about what little babies and very young children should be doing in terms of social and play skills. This is a very common question we get a lot. Programming too high for social skills, working on things like manners and turn taking and greetings and sharing and saying I'm sorry before a child has these prerequisites, which are really baby infant type of social and play skills. So let's talk about how typically developing babies, what kind of play and social skills they have. So babies and typically developing toddlers, and I am saying this because if you have a 2, a 3, a 12-year-old that doesn't have these baby skills of being social and playing, it's going to be really hard to get to the good stuff in this Playtime Social Time book, which I'm going to talk about in a few minutes. So babies, eye contact, cooing, smiling at a caregiver's face. When you point, the infant or toddler should be following your point. They should start pointing between 12 months and at the very latest by 18 months. And this isn't just like a point here or there. This is a point a lot. Every day you see pointing in a 12-month-old to 18-month-old. You have to see pointing, reaching, gesturing. If a baby or a toddler takes your hand and puts it on an item, that's called hand leading, and that's actually a red flag for autism. So lack of pointing, hand leading are red flags by 18 months of age. But young, typically developing 12-month-old, 15-month-old, 18-month-olds also bring you things to show you, to get your attention. Okay, if you are familiar with the VB MAP assessment, which I talk about a lot in my verbal behavior bundle courses, the play skills in the 0 to 18-month level include putting items in, stacking blocks, sitting on the floor or at a table, and attending to, being aware when people walk in the room, being aware when people call their names. I did a video blog on response to name, which tends to be another red flag for autism. Looking at faces, not just eye contact, but at your face, being aware. So when typically developing baby, spills milk or whatever, they would, say an 18-month-old spills milk or spills water, they would look at their parent, look down at the mess like, oh gosh, what are we going to do kind of thing to negotiate that, where a child with autism might just start playing in the water, just more of that cause and effect kind of thing. Also, when tested with bubbles, for instance, when you blow bubbles and you put it back in and, okay, your turn, a typically developing child would be looking at you like, come on, even if they're not talking, they would be looking at you, reaching, giving you the bubbles, looking at your eyes to see if it was okay, if you were going to do it. Where a child with signs of autism will just hand the bubbles back to you, to your hand, and kind of require the hand to do all the movement to get the bubbles going again. Okay, so those are kind of those. One of the things that people don't realize is that you really need to have some attention the child needs to be sitting and attending. I am a big fan of bringing very little kids, once they can sit safely, out of the high chair, out of a strapped booster seat. If you have to do that for a young child or even a child with physical disabilities, to keep them in the high chair or in a strapped in chair for safety, that's great. That's fine. But once they can freely walk and run and sit and have balance to sit at a small child-sized table, I do find that my approach revolves around pairing that table time up to be so much fun. And we are teaching language, we're teaching cooperation, we're teaching sitting skills, attending, we're teaching beginning language skills. What I find is that some early intervention professionals, me included, when I was an early intervention professional, I would often go in, and if the parents didn't have a table or didn't want to use a table, I would spend a lot of my time just chasing the child around the house, trying to, hold up a picture of a cat or a little toy figurine of a cat and saying cat once, or looking out the window and trying to get the child's attention, look at the tree. There simply just wasn't enough time of focused attention to really improve language so much. I hope you enjoyed that small excerpt. If you did, please give a thumbs up, leave a comment, and share it with somebody who might benefit. And for more information about our course and our materials, you can attend a free workshop at marybarbera.com/workshop. And I'll see you right here next week.